My name is Jake Shaw, and I did my mentorship at Springfield Veterinary Center. Now, before I start, I'd like to recognize a very special member of the audience today, Dr. Escobar. He was my mentor throughout the whole process, and as cliche as it sounds, I'll be forever grateful to you for giving me the opportunity to observe in your clinic. As you know, I had a notebook, a stack of 50 to 100 pages of notes. I learned so much, and it really helped me know what I wanted to do as a career in the future. Before mentorship, I had a lot of trouble trying to find what exactly I wanted to do. I looked into cardiology, neurology, all the ologies in between, and I finally settled on veterinary medicine because I've always had a passion for animals. I had volunteered at the SPCA in middle school and high school, and I was really excited to get the chance to observe the day-to-day going-ons in the clinic. So here's just a basic roadmap. I'm just going to set out the game plan for today about what we're going to cover. First, I'll talk to you about finding a mentor, and I'll tell you a little bit about Dr. Escobar. Then I'll go into the actual mentorship experience, what I saw, what I learned, and what I did at Virginia Tech. Quite a mouthful. In 1995, he served as president of the Central Virginia Veterinary Medical Association and has since served as legislative chair. He's traveled extensively throughout the country, giving lectures to colleagues about multimodal pain management. And this is just basically talking about the interactions of different drugs to manage pain. And among the colleagues he's talked to has been those at the Richmond SPCA, which is where I had volunteered a lot. So I found that to be really cool. And he's done a lot of work under Pfizer Pharmaceuticals, giving these lectures to people. And in 2007, Dr. Escobar received the Distinguished Veterinarian Award under the Virginia Veterinary Medical Association. He's very renowned in Virginia and beyond. People all the way from Pennsylvania have driven down with their dogs to have sperm collected for breeding purposes, specifically at Dr. Escobar's. Now, you may ask, why collect sperm? Well, for breeding purposes, what Dr. Escobar does is he takes the sperm and he puts them in this big jar that looks like it was pulled straight out of Star Trek. And you take the top off, cryogenic smoke goes everywhere, and you put the tube of sperm down in it. And basically, this allows the sperm to survive for long periods of time. So you can take it out and do an surgical insemination with it. And this is just basically taking the sperm and implanting it directly into a female bitch, and that's a female dog for you who don't know. So that was a really cool experience. I did get to see that during the mentorship. This is the actual building. It has a very personal feel, which is something that I love about Dr. Escobar's clinic. From the moment you enter the lobby to the moment you get in the room where you actually talk with Dr. Escobar or another vet who comes in, you feel a very personal connection, and you really get to find out either what's wrong with your dog if there's a problem, or what you can do to help prevent disease in the future if it's just a checkup. Okay. Now the actual mentorship experience. I'll start with this picture in the top left. For those of you who don't know, that's an ultrasound, which can be used to locate masses, nodules, and other structural abnormalities in the abdominal cavity. Now, it was really cool to see in person because I wasn't really sure what I was looking at. That's because I'm not a veterinarian. To me, it just looked like blobs of masses just floating around in blackness. But to Dr. Escobar's trained eye, he can make out puppies and other structural abnormalities. So it was a really cool experience to observe. This next room is the X-ray room, one of my personal favorites because it's not in this picture, but now there's a big computer screen there and there. And the cool thing is you can have a cursor on one screen and you can jump from one screen to the other. Now, I thought that was really cool, but it's not the only thing that goes on in that room, obviously. Dogs are brought in with broken bones, which can be located with the X-ray. And you can also run what's known as a barium series here. Now, dogs are what Dr. Escobar calls orally fixated things in some cases, in which they'll eat things they're not supposed to. And this will end up in their gastrointestinal tract and can cause all sorts of problems. So the barium series is basically the dog swallows barium, which shows up on the X-ray. You can actually monitor its progression through the digestive tract. And when it reaches an obstruction, it'll either build up or move around it, creating a specific pattern that can be observed. And so from there, you can know exactly where the obstruction is in the intestinal tract. And in one case, this is one of the strangest surgeries I've seen there. There's a dog brought in and we looked on the x-ray, and there's an obstruction that looked like a little roller skate wheel had been swallowed. And we weren't sure exactly what it was, but we went in anyway, and we did an enterotomy, which is basically we cut open the dog, and we tried to excise the object from the entero, or the intestines. And when we took it out, it turned out to be a stone the size of my fist. Now, the funny thing is, about a month or two later, this same dog was brought in. 2 fists were in its intestines. So that dog was obviously orally fixated on something. In this next picture, that's Dr. Scotty. That's one of Dr. Escobar's associates. And it looks like he's just giving a physical checkup on a dog. Now, one thing that Dr. Escobar and Dr. Scotty will do is they'll do something known as diagnosis by therapy when a dog is brought in and he's not showing symptoms characteristic of a certain disease. Now, this can be for a variety of reasons, but mainly it's because dogs are different than humans in behavior. When a dog is brought in, it'll try to hide its pain in some cases, because in the wild, from its wolf days, if a dog showed sign of weakness, then the whole pack would attack it. So dogs have learned since then to try to hide their pain in front of unknown situations. And so that makes Dr. Escobar and Dr. Scotty's job a little difficult. But what they'll do is they'll make their best estimate using their judgment, and they'll give them a drug fitting that best estimate. If the drug works, the dog is cured. If not, well, we can always go back and refine the diagnosis. In this bottom right picture, those are just 2 vet techs either taking out or inserting an IV catheter. It looks to be some kind of pre-op operation, and it's also here that we do dentistry work on the dogs. Now, you may all not know this, but dogs need dental care just as much as humans. 70% of dogs under the age of 3 develop dental care problems by the time they're 3. So I'm going to let Eric cover the rest of the dentistry. You can cover these canines. That picture, it looks like Dr. Escobar is doing some sort of reproductive surgery. And as I said, this is where the enterotomy was performed. And it was also here on the very first day of my mentorship that I was able to see a cesarean section. Now, for those of you who don't know, a cesarean section is you go into the uterus and actually take out the puppies rather than them being born naturally. Now, when we took the puppies out, one by one they were removed from the uterine horns, which are the 2 things coming out of the body of the uterus. And you take the puppies, put them in a basket. They look like little burritos to me. But we took them out and put them next to the puppy to be fed by the mother. And I was sitting there watching this with one on my face, and all of a sudden the mother reaches down and grabs one of the puppy's umbilical cords and starts swinging it around. I'm like, what is going on here? And it turns out, in the wild, the mother dog will actually eat the placenta and chew off the umbilical cord because this is also a remnant from the wolf days. They didn't want to leave any scent behind if there was a birth for predators to track down the little burritos. All right, now I'm going to get into my actual research topic. What is pain? Now, before I start, I'd like to take a preliminary poll. How many of you believe that animals feel pain exactly as humans? Okay, a couple. How many of you do not think that they're equal in feeling pain, actually perceiving it? All right, 3 people. And what's curious, I've been out in the mentorship. It's only recently that veterinarians have begun to actually treat for pain. And I found this really surprising because I always thought animals felt pain. And so we'll come back and I'll give you reasons why I believe animals are capable of feeling pain. But for now, I'll give you a general definition. Pain is defined as mental or physical distress caused by some impression on the sensory nerves. Now, these nerves are tipped by structures called nociceptors, which are basically receptors in the skin and tissue that detect pain stimuli. Now, I'm going to draw a diagram fast. All right, so here's your brain. It's a crude brain. And let's say here's the painful stimulus. Let's say a needle was injected here. Now, the nociceptors would be here, and they connect to 2 types of fibers. We have your high threshold A fibers, and these conduct signals very fast to the brain, like this. Now, on the other hand, you have unmyelinated C fibers, and these go very, very, very slowly. Not this slowly, but they go here. And it's important to note both animals and humans both possess these fibers. So there's a common ground and nociceptive structure between the two. All right, Descartes and the bait machine. Now, who here takes French? Okay, do you know what the word bait means? French?
Yeast?
No, it means dumb. Now, Descartes believed that animals lack souls. He believed in animals, animation originates out of different interactions within the body. Now, he believed that pain can only be felt with conscientia, or reflective mental awareness that only the soul endows the body. Now, from Descartes, you get a whole bunch of different philosophers who also agree with him, and they cite specific experiments. One such experiment is the blind sight example in humans. If any of you know about blind sight, it's when a blind person, when you put something in front of their field of vision, they can recall the object and even the direction of the light source. So that's pretty cool, but scientists pointed to this and said that there's some unconscious process that's going on that's allowing the blind sight patient to be able to recall the object that's placed in their field of vision. And they tried to compare this to an animal's ability to perceive pain, meaning that animals' pain perception is unconscious. Another example that they cited was in lobotomized humans. They would take out the frontal cortex, or the prefrontal cortex, and this area is responsible for feeling pain, they believe. And when this was removed in human patients, the patients reported feeling a decreased sense of noxious perception, or the perception of noxious stimuli. It's important to note that since then, other findings have shown that pain is processed in other areas of the brain, not just in the prefrontal cortex. So just because dogs, cats, and other higher organisms have smaller cortical volume in the front, doesn't mean that they have unequal ability to perceive pain, because it's processed elsewhere. All right. My belief is animals can indeed feel pain, and I have 4 topics to talk about supporting my position. First is the measurement of welfare. Now, it is true that pain is hard to classify because animals can't talk, obviously. Even recording directly from the pain fibers, it's difficult to get an accurate reading. So instead, what veterinarians will do is they'll try to diagnose through measurements of welfare. This can include white blood cell counts, blood pressure, a whole bunch of different things in the body. Now, neurological similarities, of course, the 2 different fibers are the same. And the basic nociceptive structure between animals and humans is basically almost identical. A third reason is non-reflexive willful behavior. Now, there's a guy named Ty who cited the pain construct theory, and this basically says that the intensity of the pain response correlates with the magnitude of the pain stimulus. So let's say a dog stepped on a pine cone. The farther down, or the more pressure to put on the pine cone, the increased frequency of the response would be. So it would either vocalize more, its motor reflexes would increase in strength more, stuff like that. Then the last point is top-down evolutionary support, which also includes a bottom-up approach in looking at pain. Now, the bottom-up approach views the pain, or the nociceptive perception, as being a combination of the different fibers and the receptors. It's viewed at a micro level. And as I said, they're pretty similar between animals and humans, so that's one point. But an even more important point is the top-down evolutionary support on a macro level, or how pain perception fits into the whole evolutionary scheme of things. There was a philosopher named Hardcastle, and she believed that pain in all animals gives a reproductive advantage in reproducing, hence the evolution. Think about it. If you had a cut and you didn't realize that you had it because you couldn't feel pain, you might do things to endanger that injury. You wouldn't be able to protect it. So Hardcastle believed that pain basically gives animals the ability to protect injuries in the wild. And this is a really important point. All right, so before I open it up to questions, I'd like to acknowledge Dr. Escobar again for taking the time out of his busy schedule to come and visit my presentation. I'd like to thank Ms. Parker for organizing this wonderful event and for guiding me in my research. And lastly, I'd like to thank the crew and staff at Springfield Veterinary Center for helping me to learn. So, thank you.